What's up guys, welcome back to my channel. It's Roslyn. Thank you very much for tuning in. I also want to say thank you to those people who have subscribed and shared the videos. Your support means a lot to me and I cannot thank you enough, and please continue sharing, subscribe and put the thumbs up, and let's just enjoy. Today I'll be talking to you about what skills that nurses should have. And I'll start with, to me, it's about critical thinking. As a nurse, you all know that being a nurse, you deal with people who are vulnerable, who are very ill and frustrated and worried and all that kind of thing. So when you're looking after a patient, you know that person's life really is in the palm of your hands. It's you who's in charge and has to know what to do to this patient. So as a nurse, you really need to use your critical thinking skills and think and plan ahead, so that you meet care needs of your patients. Like this patient is diabetic and I have to go check their blood sugar. But before I even go to this patient, I've already got to plan and know what to do in case this patient returns hypo or hyper result. I need to know as a nurse what action should I take before you go another step, before you start even thinking of talking to the doctor, or before you start thinking of looking for advice or assistance. You need to know as a nurse how to really use your critical thinking skills. So it's about you looking at the patient, identify a problem and plan and act as soon as possible. Reminds me, I remember when we're buying my car, the car that I have right now, I went with my husband to the car dealer, and obviously I knew the type of car that I wanted, so that's why I went specifically to this place. And then I looked at the car, liked the car, took it for a test drive, and went back to the car dealers. And this guy asked us, so what do you think? Are you taking the car or anything? And I just straight away said, yeah, I like the car and we're taking it. And this guy was like, are you a nurse? I said, why? He said, because you've made a very quick decision, and I know that nurses who do that, they make their decision very quick. They don't have time to muck around. So that's critical thinking, and making your decisions very quick and promptly is one very, very important skill that nurses really ought to have and practice. But you get to learn this as you go, along the way. It's something that you're not just gonna go boom and do it straight away. So you have to keep practicing, and you get used to it. Another skill is reliability. Really, as a nurse, people should be able to rely on you. You should be able to do what you tell your patients or your team members, fulfill your promise. That's one thing I know as a nurse. Even me now practicing as a nurse, I know that I need to be able to fulfill my promise. I need to be trusted by the patients and all my team members. As a nurse, you have your I have my patient, and they've asked me a question that I do not know the answer straight away. So what you need to do as a nurse is to go find out for this patient or the family or anybody, and then go back to them and tell them what is happening, give them the answer. So it's not about you saying, oh, I don't know, and then you leave it at that. Nurses don't leave anything hanging, to be honest. For all the years I've practiced as a nurse, I know that if I have said I am coming back, I need to come back. I have to go back. So nurses are supposed to be very reliable people. That's the beauty of it. And teamwork. I get so excited when I talk about teamwork, because I know that every time I'm at work, I have this strength in me, and I have this I don't know how I can put it, but knowing that I've got somebody who can help me at any time, or who I can consult at any time, or who I can who can help me generally, is something that I cannot I can't emphasize enough. like teamwork as a nurse, you should be able to work with other team members all at all time. Like I'll give you an example. If you got, like, for us at work, I work in a general medical ward. I'll keep saying this all the time. I have 4 patients, or sometimes 5, really depending on the staffing that day. But yeah, so if, for example, I'm caught up with a patient, and then my other patient is calling for help, the other member of the team should be able to go and help, or will always be able to go and help. So that teamwork, is what nurses really need to practice and learn and do at all times, like helping each other, working with each other, consulting. I mean, we're dealing with people's lives. Any small mistake, just 2 seconds, can be fatal. So as nurses, you really need to have that skill of teamwork, and I love it. Like, I love where I work right now in the general medical ward. Oh my God, we have the best team. I cannot tell you that. I'm so proud of my team, and that's one thing that gets me out of my house every day to go to work. Like, you people know nursing is hectic. I can assure you that nursing is hectic. By the time you finish your shift, you are drained, you are exhausted, you are tired. Sometimes I come back on my feet, I just don't even want to step on the ground. Like, that's how exhausting nursing can be, because you are using your brain, you are using your eyes, you're using your feet, you're using your mouth, talking to everything. So it's hectic. So working as a team is a skill that nurses ought to have, like adaptability. You should be able to really embrace changes at any time. Like, we all know that in the hospitals, there are lots of changes that can happen, and they can just be that quick. In a split of a second, things can change. Like, for example, if there can be an outbreak, and then you got to move wards, you got to move staff out of the ward and take them to some other places to work. Or there can be an emergency straight away, and then you just have to really get used to adapting to change easily and embracing it, and doing your work smoothly. As nurses, to the changes is one thing that nurses really have to do, and it's a very good skill, because then at the end of the day, you are there for the patients and not for anyone else. It's mainly the patients. That's why you're there. So you should be able to adapt to changes and be okay with it, and still meet your patient's needs. And then communication. As nurses, we really do a lot of communicating to people. First of all, we communicate with patients, and then we communicate with their families. We be able to, first of all, verbally speak to people. And another thing is documentation, and just handing over. I remember when I had just started my nursing in the hospital, I was so worried of the bedside handover. I don't know why. I was always worrying about it when I was about to hand over. I'm like, oh, how am I going to talk? What am I going to tell them? And how am I going to feel? Will they understand what I'm saying? Will they, but first day I did it, I was like, oh, that was a huge relief, to be honest. And as I kept on, practicing, because you have to hand over anyway, you cannot run away from it. So you have to hand over your patients to your next nurse. As I got used to it, bedside handover, it's not just like, walk in the park. I actually look forward to it, because then once I hand over, I can go and have, my break, or I can go home. So yeah, nurses ought to really be good communicators at all times. And then being kind. Kindness to people is one thing that nurses really are supposed to do. Like, just it just takes a small thing to change somebody's life, or to make somebody happy. I mean, as a nurse, we like I said earlier on, we are dealing with people who are somebody who's not well, somebody who's worried, someone who has been slammed with a very serious diagnosis. So there's a lot of frustration there. There's a lot of tears. There's a lot of worries. If you just treat this person with kindness, it makes a lot of difference. It changes somebody's life. Just you being kind and talking to somebody nicely and putting yourself in their shoes and offering them something. You know, there are a lot of things, like small gestures that you can do to show kindness to your patients. And that brings me to the end of this topic today. So thank you so much for your time. Thank you for watching, and please don't forget to subscribe, click the thumbs up and notification bell so that you are notified next time when I post my video. And please don't forget to share the videos as well with your friends or anybody you think might benefit from it. And I'm telling you, I'm enjoying nursing. Much as it's hectic, I really love it, because I know that every time I get out of my house, I am saving a life, I am changing a life, I am helping somebody, you know. So yeah, for those of you who are still doubting, not sure whether to join nursing, it is the right career for you to join. So thank you, and I'll catch you later. Bye.